Dr. Dhanani, you've been in the field for 20 years. You find this to be one
Mm.
of the most potent tools that you use diagnostically. It's not a therapeutic tool, it's a diagnostic tool. And it's a means of dialogue with your patient. But a question here comes to mind. Um, you know how most tests are pictures at a moment t in time. They're not a
Right.
moving picture. So patients often tell us, well, we feel like this, and they look a certain way. And there's a discrepancy between how they feel and how they look with the lab results, which are just a picture at that moment t in time.
Yeah.
And I explain, at least to my patients, I believe you do too, that, as naturopaths, we're detectives, and we look as holistic practitioners at the big picture, and we take very much into consideration clinical symptoms, a life story.
Hmm.
How does a drop of blood with live or dark field microscopy work? Is it a picture, a snapshot, a moment in time? Or is it actually quite a rich visual manifestation of a moving picture of what brought the person to become the person he is when he gave that drop of blood?
Thank you. It's a great question. And so there are some aspects that are a picture of a moment in time, but most of the information that I receive from that dark field, strictly from that dark field, is a backdrop of their environment. And that environment is set for months at a time.
So that,
So as an
yes,
the reason why I starve my patients and I dehydrate them is because I want to get a clear picture of how their body handles their fluids, but also if we are digesting our food really, really well, our food should be absorbed within 6 hours of our last meal. If I give patients a 8, 12, 16-hour fast and I see undigested food particles, it speaks very, very clearly to me about their absorption and their digestion, which is different than their terrain.
so very interesting. Okay, so it's both a picture and a moving picture. It gives you a window that enables you then to personalize the therapeutic
Right.
solution. Because
Yeah.
we've entered now this era of the personalization of lifestyle medicine. Okay, and the patient then becomes more compliant because he or she visualizes what's going on in their body, and that actually, well, generally leaves a trace on them and makes them realize that it's not just a practitioner, a doctor interpreting a dry sheet of paper. Fair
Exactly.
enough. But then another question comes to mind, which is how quantifiable is this, or is it just qualitative? This is the big question. I mean, how do we take it to the next level?
Yeah, so certainly a drop of blood is no way, by any stretch of the imagination, a full representation of 5 liters of blood, but it does give us that window. If there is an inflammatory process, if there's an infectious process, if there's an immune process, we're able to determine and distinguish between these from not only just the dark field, but the BEV and the various other techniques that we have in the office.
So in this fascinating sort of post-COVID, if it truly is a post-COVID era that we're living in, where some people reacted better than others to the virus, others to uh, what some call a vaccine, and others. My question to you is, can you see the vaccine injuries through a drop of blood? Could you see why certain individual metabolic types reacted better or worse to the actual virus, to the SARS-CoV-2, versus the Western or non-Western vaccines that were administered over the last few years? I know this is a very hot topic, and
Absolutely. It's somewhat of a loaded question, so I'll answer it in two steps. The first step is probably going to require a second conversation at some point, but it was clearly not a vaccine. The impact that it's had on the immune system has been dramatic. The impact of cardiovascular disease, cerebrovascular disease, blood flow in general, as well as autoimmunity has gone up quite substantially. And so this was certainly a questionable process, this vaccine. But to answer your question more directly, yes, we are able to see spike proteins in the blood. We're able to see whether or not an individual will respond quite favorably to either this treatment, this vaccine, quote unquote, versus being exposed to COVID in its raw form, as well as to spike proteins in its raw form. I've been able to look at the blood and say, so when did you get exposed, either from a vaccine or from a virus? And the patients will very clearly tell me, well, in the last week, or 2 weeks, I got COVID, because we can see that present in the blood. And so I will say that most of my patients and I apologize if it's controversial, but most of my patients in my office are unvaccinated. Most of the new patients that I'm seeing now with their chronic diseases have all been vaccinated, and this might be just either a sequela or a complication of the vaccine, or vaccine in COVID on top of.
But I understand that there's also a notion of shedding, which is, of course, brings up and opens up a fascinating
Yeah.
new outlook on this. But I guess we'll discuss this on a different podcast. So, Dr. Nani, to wrap everything up, you're a holistic minded practitioner who found his voice and his path in Germany through by regarding health and your patients in a holistic manner through the prism of biological medicine, which essentially enables you to map each person individually, taking one drop of blood on an empty stomach after having had them fast and not drink for six hours minimum. It allows you to zoom into their terrain and to understand why each person reacts differently to viruses, to situations, let's put it this way, and why a person gets sick versus another, falls sick versus another person having a more resilient adaptation to that um, virus or that pathogen by virtue of having a stronger terrain. It gives you also a possibility, or gives your patients a possibility of being more compliant, because a picture paints 1,000 words. Once they visualize what's going inside them, it's often easier for many people to have that switch, and to accept a new lifestyle that goes, I imagine, with supplements, food, better hydration, more intelligent movement, more sports, better sleep. So you bring in an array of different tools now in your toolbox, I imagine, to help your patients thrive.
Absolutely. I certainly believe, to reiterate this, absolutely. I find that a patient that has an autoimmune disease, that's not their disease. There's always a reason as to why they have an autoimmune disease. And if we just treat that autoimmune disease, for example, we might mitigate some of the symptoms, but there's often going to be an acute exacerbation or a flare-up. And so you're always dancing, trying to, put the fire out, just keep it smoldering, if you will. Whereas the conceptual framework of biological medicine is always looking at the root cause, and we're using a variety of different techniques to be able to achieve
And
that.
the important thing is, patients walk in having fasted. You generally have not. I'm sorry to disappoint you, patients of Dr. Dhanani, but most of them, you don't actually read their intake forms and do all that homework before. You essentially meet them from scratch, and you allow for the blood to reveal a lot of the information, and then you juxtapose this information that you observe with their intake forms and their more conventional lab results as well, to create an integrative health protocol to help them. Is that
Yeah,
correct?
it's plata de rasa. It's a clean slate. I don't want to know anything about you. I want to know what your body is telling me.
What I would really like to discuss with you in our next conversation is how, since a person walks in and that drop of blood reveals a lot about his or her inner workings, um, what does it reveal about trauma? What does it reveal about emotional health, um, acquired and inherited? How does that manifest in the blood? Is there a possibility of, and of course, I know we're entering a much more gray area, but I mean, is there a way of actually, do you see that aspect of a person's life story in their blood without them mentioning anything?
Yeah, completely. I've got numerous stories of patients that have walked into the office where their blood is so incredibly overlapped, not related to dehydration. There's this framework called rouleau, where cells are essentially stacked upon each other. Their cells are literally stuck. And I ask the question, are you stuck? And the response, meaning emotionally stuck, um, psychologically stuck. And the responses that I get from patients are really quite dramatic. In some cases, and I recall doing this just as little as last week, I don't treat the patient with any supplements. I put them on a bioresonance device, and I send them home, and I tell them to get unstuck. I tell them to make a decision. They're in between two decisions. Just make a decision and stick to it, and have them come back after a couple of weeks. They come back and their blood is less stuck. Interesting. So certainly there's holographs, there's images in the blood. There's lots of things that we can evolve from that blood picture. Certainly there is. But when you couple that with HRV testing and other emotional testing, it paints a much broader, bigger picture from the psychological and spiritual side of things. But certainly you can.
No, this is fascinating, Dr. Nani. This makes me want to fast, fly to Ontario, give you a drop of blood. So thank you very much.
I'll be there.
Dr. Karim Dhanani, Center for Biological Medicine in Ontario, Canada. Feel free to try to reach out to him. I believe there's about a 2-year waiting period, but if you send me a message, I'll try to shorten the waiting period for you. Thank you very much. Thank you, and we really look forward to. It was a fascinating, first of all, story. Your story is really beautiful, and I really look forward to speaking to you more and to finding out more about how you take your patients on that journey from where they're stuck to where they accept to being unstuck and to make those decisions that allow them then to discover happiness and optimum health. Thank you, Dhanani, for
Absolutely. Thank you. Thank you very much.